Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about or few of the procedures which are used in the treatment of atherosclerosis. So when we discussed in our previous classes, we have spoken about the non-invasive way, and in that we have spoken about the medicines which are used for the treatment of atherosclerosis. There are certain procedures, invasive methods which are used in the treatment of atherosclerosis. We will just understand the terminologies and what do we do basically in this procedure very briefly in this video. So these are the procedures which are used in the treatment of atherosclerosis. One is the angioplasty. So angioplasty is nothing but whenever there is a blockage of the artery, we use a balloon which is inflated inside the blocked artery so that it is widened, and we place a stent inside it so that the vessel is kept open. Then whenever there is blockage is too much, we cannot do anything on that vessel. We use or we create a new pathway around the blocked coronary artery. That would be your coronary bypass. And when the carotid artery is involved, we use this procedure called as carotid endarterectomy to treat the atherosclerosis in that vessel. So angioplasty, I have told you, this is a very minimally invasive procedure and very commonly done. And this is a procedure which is used to widen the lumen of the vessel. So you can see here, this is the artery, and you can see it is narrowed down because of the atherosclerosis. And you can see the poor blood flow here. So whenever there is such an artery, we use this deflated balloon, and through which we put a stent here, and that will hold the lumen to be stiff, and then the blood flows through it. The force of the blood flow increases. There is a good blood flow restored. So this angioplasty is a procedure which we use to open the blocked coronary artery, which is usually caused by this atherosclerosis, and this will restore the blood flow to the heart muscle without opening the heart. So this can be done in emergency also. Whenever the patient comes and suddenly if the doctor finds out that there are blockages and we can intervene, this can be done in an emergency setting also, such as an heart attack. So here you can see this is a cholesterol which is built up here, and it is partially blocking the blood flow. Here we are passing a stent with a balloon. So this is a stent which has gone here, and this is the balloon which is inserted into the blocked artery. And here you can see that the balloon inflated to expand the stent, and here you can see that this stent is expanded now and the blood flow is restored. You can see the lumen has widened and the blood flow is restored here. So this is the blood vessel, this is the plaque, and here you can see the blood flowing, and see the blood flow, it is reduced so much. Here you can see the stent. Here there is a balloon attached, so the balloon is inflated here, and once this is inflated, you can see that the with the help of this guide wire, the balloon is removed and the stent is left at place, and that will restore the blood flow in this blocked arteries. So that was the first procedure. If you want to know the exact or the complete procedure for angioplasty, how it is done, what are the pre-requirements, how is the procedure done, what are the aftercare for angioplasty, let me know in the comments. I will make a separate video on the procedure of angioplasty. So then we have second method, that is mechanical thrombectomy. So this mechanical thrombectomy is an minimally invasive procedure. What it does is it removes the blood clot from the arteries, and it will restore the blood flow. So this is an emergency procedure. Usually whenever we see that there is a thrombus in the deep vein thrombus, etc., we use this procedure. And here the doctor inserts a catheter into the artery, it might be in the groin area or in the wrist area, and then this catheter is guided by this X-ray imaging, and this device like a stent retriever or a coil retriever is inserted into the catheter, and advanced past the clot. So this device will expand and it will grab this clot. So the device and the clot are pulled back through the artery out of this incision. So you can see here, this is the catheter aspiration which is pulling back. The clot is removed here by section, and here you can see that the mechanical thrombectomy, here the blood clot is broken up into small pieces and then it is removed. So it is usually used to treat this moderate strokes and large vessel occlusion. The faster the treatment is received, the better will be the outcome of this procedure. I have also told you this atherosclerosis can involve the blood vessels of the neck, the carotid blood vessels, and this procedure, carotid endarterectomy, is a procedure that removes the plaque from the carotid arteries in the neck. So this procedure is performed to treat the carotid artery disease and to reduce the risk of stroke in that patient. So the surgeon will make an incision in the neck over the affected carotid artery, and the artery is opened and the plaque is removed. Then the artery is stitched back. Here you can see it is stitched back. So it is usually done in patients who have moderate to severe blockages in their carotid arteries. So you can see here, this is the carotid artery. Here this is identified. This is opened and there is a cut done. The plaque is removed and it is stitched and the normal blood flow is restored. So sometimes this patient can have bleeding, infection, blood clot, nerve damage, etc. So carotid artery stent placement is an alternative procedure that involves placing of this mesh cylinder into the narrow section of the artery. So this is again the carotid endarterectomy. So here you can see this is removed, incision is made and it is removed, and here it is stitched. So then you have something called as a coronary bypass surgery. So this coronary artery bypass surgery is a heart surgery that will improve the blood flow to the heart. So how and what does this surgery do? This what it will do is it will use a healthy blood vessel from other part of your body and it will bypass the blocked coronary artery. The artery is so much blocked, we can't do any kind of a repair. We just change the route, we create another route for the blood flow. So a new route for the blood flow to the heart. So here the surgeon will take a healthy blood vessel from another part of your body and he will create a new pathway. So the blood then goes around the blocked or narrowed coronary artery. So this coronary artery bypass graft is an open heart surgery. It is usually done only in people who have many narrowed arteries. So here you can see the grafted blood vessel here, and this are the arteries which were completely blocked. So we have grafted this vessel and it has restored the blood flow here, and we have bypassed this vessel here. So you can see here, this was the artery which was completely blocked here, and after that here the improved blood flow which has happened with the two channels which are added. So here we bypass this artery. Many arteries are involved which are blocked, and also it is severely blocked. So in such cases we try to bypass this and with a new vessel and create or resume blood flow with a different channel. So this is again, I have told you that this is the grafted blood vessels. You can see we have taken it from the leg and then we have bypassed this blocked artery, so that once we put this blood vessel here, it will establish the blood flow to the heart. So the surgeon will make an incision in the chest and separate the breastbones or sternum to assess the heart. He will remove a piece of blood vessel from another part of the body, and this would be called as a graft. So then surgeon will attach one end of the graft above the blockage and other one below the blockage, so that the blood flow is restored. So you can see here, so this is a venous bypass graft here. These were just the in brief the invasive methods which we are using to treat this atherosclerosis. Because atherosclerosis has become so rampant, we see so many cases wherein the patient is rushed into the hospital and the patient ends up getting an angioplasty done or a stenting done, etc. So you will have to know what are these terminologies. What do you mean by angioplasty? what happens in angioplasty, what happens in a carotid endarterectomy, what is this bypass surgery. So all these things would help you to make the patient understand, your relatives understand what is this procedure, and how we are trying to restore the blood flow. So these treatment options are very common nowadays and done in majority of the hospitals. So we cover here the invasive methods of treating this atherosclerosis. So in the non-invasive method, we have covered the medicine part of it, and in the invasive method we have covered the procedures. The important part of this atherosclerosis and the crux of this atherosclerosis lies in the lifestyle management, the most difficult part of treating this atherosclerosis. We will cover this also in our coming videos, because it is important for us to understand what is the root cause and how do we treat and how do we stop the progression of this atherosclerosis through our lifestyle management. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.